Hello and welcome to my presentation. Today we're exploring the CFTR gene, short for cystic fibrosis transmembrane conductance regulator, and how mutations in this gene cause cystic fibrosis, a life-altering genetic disease, and my name is Ari Petros. The CFTR gene encodes a protein that forms a channel responsible for moving chloride ions across epithelial cell membranes. This function is essential for keeping mucus thin and flowing, particularly in the lungs, pancreas, and digestive tract. When the CFTR protein doesn't work properly, it disrupts this delicate salt and water balance. The CFTR gene is located on the long arm of chromosome 7, specifically at position 7q31.2. As you can see in this diagram, this region contains 27 exons that collectively code for the CFTR protein. This spot is crucial because many disease-causing mutations occur here. Here in the diagram, the CFTR gene is highlighted on chromosome 7. This visual helps show how gene mapping ties directly to disease diagnosis. Mutations in the CFTR gene lead to cystic fibrosis. These mutations cause a loss of chloride channel function, resulting in the production of abnormally thick and sticky mucus that can clog airways and ducts in various organs. Symptoms of CF are systemic. The most common include chronic lung infections, persistent coughing, and salty tasting skin. Some individuals also suffer from digestive malabsorption, and in males, infertility due to a missing vas deferens. This image shows the thickened mucus obstructing the airways. It demonstrates how CF affects the respiratory system, one of the most impacted areas from CF. CF affects roughly 1 in 2,500 to 3,500 white newborns, particularly those of European descent. It's rarer in African and Asian populations. Worldwide, between 70,000 and 100,000 people live with CF. Thanks to modern treatments, life expectancy for CF patients has improved to about 40 to 50 years. Therapies include CFTR modulators like Trifacta, chest physiotherapies, and pancreatic enzyme supplements. In advanced cases, lung transplants are considered. The most common CF-causing mutation is at F508, a deletion of phenylalanine at position 508. This leads to misfolding of the CFTR protein. Other mutations like G542X and G551D also impact CFTR function by affecting either gating or synthesis. CF is inherited in an autosomal recessive manner, which means a person must inherit 2 defective copies, one from each parent, to develop the disease. Carriers usually have no symptoms. This Punnett square visualizes inheritance. When both parents are carriers, each child has a 25% chance of having CF, 50% chance of being a carrier, and 25% chance of being unaffected. The mRNA transcript for CFTR is approximately 6.1 kilobases long and includes 27 exons. Disease-causing mutations can lead to improper splicing, resulting in non-functional or degraded mRNA. The wild-type CFTR proteins contains 1,480 amino acids. The F508 mutations remove just 1 amino acid, but this tiny change leads to serious folding defects. The protein is often degraded before it ever reaches the membrane. CFTR normally regulates chloride and bicarbonate transport. The F508 mutation prevents the protein from folding correctly, so it gets trapped in the endoplasmic reticulum and fails to reach the cell's surface. This structural diagram highlights the NBD1 domain, where F508 occurs. Misfolding here disrupts the entire protein stability and transport. Here's how the disease works on a cellular level. Without functional CFTR, chloride and water can't exit the cell properly. This results in dehydrated, sticky mucus that clogs airways and traps bacteria, leading to chronic infections and inflammation. This illustration contrasts normal chloride flow and disrupted CFTR activity. You can clearly see how defective ion transport leads to mucus buildup. To summarize, the CFTR mutations cause a systemic disease that primarily impacts mucus-secreting tissues. Advances like CFTR modulators are game changers, but early diagnosis and continued research are essential for better outcomes. These are the references I used, all peer-reviewed and sourced through PubMD and NCBI. You can find the full list in our project.